Hi, I'm Nora Bachman. I'm a pediatric physical therapist, and I wanted to talk a little bit about W sitting. So, W sitting is when a child creates this W position with their legs. Now, if your child is doing this off and on, they're moving through this W position when they're going in and out of other positions, that's not such a big deal. I become more concerned when a child's got a very strong preference for this position and isn't really spending time in other positions, particularly as they get older. It's typical to hang out here a little bit, but generally, some of the more preferred positions are a side sit, where both legs point in the same direction. And if you can, it's nice to see them doing some side sit in both directions. So again, you're not seeing a very strong preference. A long sit position is also a good one because that requires a little more strength. So one of the reasons why we don't love a W position is because it puts a lot of strain on the hips and knees in particular by placing those joints at their end range of motion. So it puts a lot of pressure on the soft tissue structures like the medial ligaments of the knee and a little bit in the hip. It also can indicate that there's a weakness, or for some reason the child's not really able to activate the core and trunk musculature to keep themselves upright. So having this kind of narrow base of support, the part of the body that's touching the ground, is harder than being out really wide like this. But it's not as functional. So if a child's in this position and they want to grab for something over here, it's a lot harder to reach because they're so splayed out, rather than if they were in a side sit position and they could do some rotation. If they were in a short sit position where they're on a chair, long sit, kneeling, or even laying down, just changing it up a little bit.